So again, we have our roads. But in this case, they're cats and dogs. Medicare Parts A and B and Medigap go together. Medicare Advantage and Medigaps do not. So, from Medicare and You 2019, you can't enroll and don't need a Medicare supplement insurance or Medigap policy while you're in a Medicare Advantage plan. You can't use it to pay expenses, such as copays, deductibles, or premiums you have under a Medicare Advantage plan. If you have a Medigap policy and you join a Medicare Advantage plan, you will want to drop your Medigap policy. If you have a plan and somebody's trying to sell you both, they are against the law and they need to be reported. Contact the hospital, let them know, they'll report them. Contact 1-800-MEDICARE and report that individual. And we're really adamant about that because we don't want it to be open season on seniors. Okay? There's not a need to have both. So now let's talk about how to enroll and what participation really means. You're not required to join a Medicare Advantage plan. You can have just Plan A. Remember I talked about, Plan A is free, so if that's all you want, you can do that, you can. There's no penalty to join a Medicare Advantage plan. There's no penalty if you leave a Medicare Advantage plan and go back to original Medicare. Those are two of the fallacies I hear the most. Okay? The only penalty that could apply in any of the plans is Plan D, your prescription drug plans. Okay? If I'm turning 65 and I don't take any medicine, I don't take any prescriptions at all, why would I want to buy a plan that has prescription drugs included? I'm just paying extra for it, right? Would you agree with that statement? Okay? Here's why you might want to think of that differently. I'm now turning 70. I'm now on a half a dozen different pill bottles that I have no idea what's in them. But I need prescription drug coverage. So I have Plan F. I'm going to keep Plan F. I don't want to change that. But I've got to buy a standalone drug plan. When I do, the government is going to penalize or surcharge you 1% of the average premium over that 60 months, 5 years, 65 to 70, that you didn't have coverage. So depending on your plan, depending on where you live, could be $10 extra a month, could be $30 extra a month. We'd have to calculate it. But that's the only time there is any kind of penalties involved in Medicare or Medicare Advantage. Okay?
Why do they do that to you? If you're not sick, lady, take care of yourself, then you're getting punished because you don't take anything.
It's a wonderful question that I don't have a good answer for.
Yeah, I went through that. It should have been, it was supposed to be $17, but because I waited till I was 70, it went up to 43.
Yeah.
I do understand that.
Yeah. The main reason for it is twofold. One, you have a Medicare Advantage plan. Here's a reason to buy a Medicare Advantage plan that has drugs included. So that's an option. The government says it's there. You don't have to go without it. That's number one. Number two, Medicare Advantage standalone plans you can buy very inexpensively. So the government looks at it from that standpoint that you've got two options that you can purchase them. Okay? Just because you don't take drugs now, you may later. And so the government, in their way of thinking, would rather have you buy something than not have it.
But if you have a Medicare Advantage plan and that has the prescription included,
Thank you.
and you decide to go back to original Medicare
Mm-hmm.
and buy a supplemental
Mm-hmm.
insurance
And the Part D,
and Part D,
no penalty. No penalty. Correct. So, and do it the other way. I already have A plus B plus D plus a supplement, and I want to get rid of all that and go to Medicare Advantage with a prescription drug plan, no penalty.
So either way, you would get a penalty if you didn't have D or...
The only way you're going to get a penalty is if you didn't have it. If you went 5 years without it. Okay?
Okay, so you...
Now, I'm sorry. Let me finish because you had said it almost doubled on yours. Okay? Was that going to be true across all of the plans that you looked at?
All of this is very...
It's confusing. Okay.
So, I don't know if I'm with the right thing.
All right, and we're going to show some of that in a little bit, so I appreciate you talking about that. Go ahead.
Okay, so you said like this is the only penalty. I thought if you didn't enroll like in Medicare within a certain period of when you turn whatever the age you're eligible.
It was 3 months before and 3
Yeah,
months
three
after.
Yeah,
months.
okay.
But isn't there a penalty if you don't
No, No.
enroll in that period?
no, not premium penalty. Okay, so when you turn 65 or when you become eligible for Medicare, there's a difference in that. Turning 65, you have the first 3 months before you're 65, the month you're turning 65, and the 3 months after. So you have a 7-month window that you can purchase a Medicare supplement without asking any medical questions. It's guaranteed issue. However, 8th month, okay, there are companies who are going to say, you're outside of the 7-month window. We now have the right to ask you your medical questions, and we can either surcharge your premium, okay, or deny you coverage. Blue Cross in Illinois currently is the only company that doesn't do that. You can buy a Blue Cross plan, no questions asked, 12 months a year. Okay? But that's the only company right now. So there's no penalty, okay? It's a different terminology again. And that's where people get confused, and I apologize. That's why it's frustrating with how people explain things. Okay? Does that make sense? Everybody caught that? All right. Now, what did I say the difference is between turning 65 and your first eligibility for Medicare? Isn't that the same thing? No. Because if I turn 65 and I opt out of Part B because I'm still working and I'm staying on my employer's plan because it's actually better coverage and less premium, and when I retire at 70, that's my first eligibility for Part B. So when I'm first eligible for Part B is our trigger point. Your Medicare ID card is going to show 2 different dates on it. Medicare A will be your age 65. Medicare B would be your age 70 eligibility. Does that make sense? Okay. So when you're retiring at age 70, the key is roughly 60 days before you're going to retire, you want to look at, do I want a Medicare Advantage plan down this road, or do I want original Medicare and a supplement down this road? Okay?
But you can go on Medicare at 65 even if you're still working, right?
You get Part A, you
Can get Part B?
can, but you're spending money you don't need to if you're still working and staying on your employer
What
plan.
if you're paying the insurance
Yeah.
yourself?
If you're paying, if it's self-employed, correct. Then that's a different story.
Okay.
Okay? Self-employed, yes, the recommendation would be take Medicare Part A and B and buy a supplement or
Right.
buy a Medicare Advantage. But for people who work for employers that are 20 employees or more,
Right.
okay, rules are different. Is that okay? All right, great questions. Keep them coming. Makes the school much better. All right. You can decide to join a Medicare Advantage plan down the road, as we're talking about. To join a Medicare Advantage plan, you must have Parts A and B. You must pay the Part B premium. So just because you're buying a Medicare Advantage plan, it does not exempt you from that $135 a month. You have to pay that no matter which road you go down. Everybody understands that?
Where does the Medicare Advantage people get their reimbursement from Medicare?
When you say people, you mean the companies?
Companies?
Okay. Because the companies, yes, they are paid a per head per month based on their how, and actually they have a caveat there again of how healthy their book of business is compared to how sick their book of business is. Okay? So they can get paid differently. All right? That's again why a Medicare Advantage plan, you can't be in an ACO because they're already doing that quality of care. Okay? Good point. All right, so participation continued. If you participate in original Medicare and want to make no changes during October 15th to December 7th, don't. If somebody comes to you and says you need to sign this in order to renew your policy, you're going to end up making a change and losing coverage. You do not sign anything. Medicare is not going to call you. Medicare is not going to email you. Medicare is not going to send you anything. Your Medicare Advantage plan can send you a notice that says here are changes. And if you want to accept those changes, you don't do anything. If you want to not accept those changes, that's what open enrollment is about. Does that make sense? So you like what you have, don't do anything. Leave everything alone. If you don't like what you have, now we have some studying to do. If you participate in a Medicare Advantage plan, what I was talking about, each year you have that option to come in and go out. Remember, if you do not make changes of coverage, nothing will change. Everything begins and ends with you. That's what's important. You may join a Medicare Advantage plan when you first become eligible for Medicare, turning age 65, or retiring. The 3 months before or after your 25th month of Medicare eligible disability. I had some people questioning that yesterday. You're under age 65 and you're disabled. You're Medicare approved disabled. You cannot have Medicare until you have been disabled 24 months. On that 25th month, you can then enroll into a Medicare Advantage or into a supplement. Okay? During the annual open enrollment period. Does that open enrollment period change year to year? No. It is always October 15th to December 7th. Wait a second. It's now January. I bought this Medicare Advantage plan, and December 31st, I got a letter from the HMO that my doctor's retiring. I bought that plan because he was in it. Now what do? I don't like the other doctors, by the way. I only like him. I don't like the other doctors. Okay? All right, so let's talk about some rules and some bailouts. Special rules. If you move out of the plan service area, you can make a change in your plan. What's a plan service area? The county you live in. So if you move from Paris to Champaign, you have different plans that may be available. You can look at making changes. If you move across country to Arizona and you have an HMO that was bought in Illinois, are you going to be able to retain it? No, because you don't have the HMO doctors in Arizona that you have in Illinois. Okay? So you have that opportunity then to make a change. Okay? If you have both Medicare and Medicaid, but you lose your Medicaid eligibility, now you have an opportunity to make changes. Okay? Same goes by, you're in Medicare, but you gain Medicaid eligibility, now you can make a change again. Okay? If you qualify for extra help is different than Medicaid. Extra help means that you have a lower income and you need some extra help to pay for things. That's through the state again. You're in a skilled nursing facility. You enter a skilled nursing facility. You leave a skilled nursing facility. That time, you have an opportunity to look at changes. You may not, but you have the opportunity. You disenroll from an employer group health plan. I've gone over this a couple times, but I want to say it again. If you're eligible to retire, but you don't, when you finally decide to retire and leave, then you have an option to make plan changes. Okay? Entrepreneurs, generally at age 65, or sole business owners, you go to Medicare at that time. You switch to a 5-star Medicare Advantage plan. Anybody seen a unicorn lately? I haven't found any Medicare 5-star plans in Illinois. Okay, that's what that means. A 5-star plan, every plan is rated. They're rated by you, they're rated by providers on quality of care, quality of service, quality of plan design, and they'll range from a 3 to a 5. Now think of a fancy restaurant. If a fancy restaurant has a 2, are you going to go have dinner there? Probably not. But if they had it's on Medicare. I'll show you in a moment. Okay? But if there's a 5 or a 4, okay, that means they're getting good reports. Everybody uses some kind of star rating today. All right? So here's the big change. In the past, you had a 30-day window in January to make changes. But all you could do was go back to original Medicare. Now, you're going to have, number one, all the way to March 31st. You're going to have the first 90 days to say, oops, I made a mistake, I don't like this, I'm out. You can do it any time between January 1 and March 31st. The second part of that good news is you can go to a different Medicare Advantage plan. You don't have to just go back to original Medicare. Okay? Or vice versa. But April Fool's Day, you're locked in. Gives a new definition to April Fool's Day. Okay? So you've got a new opportunity that 90 days to look at what you've done, or because your doctor left the HMO or retired, you can make a change. Okay? Two roads. Are they ever going to cross?
No.
Are they ever going to come together and be one? Exactly. Medicare Advantage, original Medicare. So you have some decision times to think about. October 1, start comparing your coverage. That's when Medicare.gov puts things out. That's when you start seeing all of the paperwork come flooding to your door. By the way, I get tons of paperwork too, but I am cautioning you, open every piece of mail. Make sure it's not something specific to you, because it's going to look like junk mail, but it may not be. And if you don't open it, you don't know that. I've had more and more people, especially with Medicare Advantage plans, that they have a whole formulary change and they didn't know it because they threw it all away. They never opened it. Okay? So extremely important. October 15th to December 7th, open enrollment right now, where we're at. We have a month left. January 1st, okay, that's our new window. You bought something, really wasn't what you thought it was, make your change. You can change it. And again, up to March 31st. So let's look at right here in our backyard, Edgar County. We have our 10 basic plans for Medicare supplements, but we have 40 insurance companies. Okay? The good news is the plans are no different. Okay? Doesn't matter, Plan F is Plan F is Plan F. Doesn't matter what insurance company that 40. So you can narrow it down by what does Aunt Betty like. Okay? You also have the option, if you're on an employer plan, you may want to keep it. If you're on a union plan, you may want to keep it, because they would love nothing more than for you to leave. Okay? Because you don't get them back once you leave. All right? Federal Employee Benefit Program. If you're a federal senator or federal employee, you've got much better benefits than what you're going to buy. Okay? TRICARE for Life. I've had a lot of people who, retired veterans, that's a very good program. They want to keep that. All right? We don't have a lot of talk about Indian Health Services here in Illinois, but it is available. There are 16 Medicare Advantage plans in the area. That's not very many. I was in Missouri, and one of the counties there had 25. Okay? Had another one at 30. However, there are 27 standalone drug plans. That's the big key. There's 27 standalone drug plans. Doesn't matter what county, it's across the state. So here are the plans that we have in the area. And you'll notice Health Alliance, right up the street in Champaign, Aetna, and then Humana. We have one new company down at the bottom, out of Texas, by the name of Lasso. Anybody find that comical? I do. Lasso, Texas? Okay. Again, it's a zero premium, but what? It's a $6,700 deductible. Okay? What deductibles Plan F have? Zero. What out-of-pocket does Plan F have? Zero. Exactly. Can I make a buying decision off of this slide? No, I can't. All this does is tell me that it's an HMO or it's a PPO, all right? And some of them have zero premium, some of them have 155. What's the difference? I have no idea from this. But unfortunately, we have people who buy based on a chart like this. All right? That's why you're here. I don't want you to buy based on a chart like this.